And good morning, everyone. I'm Eric Reynolds here at Fox 10 News. We're in the process about to join Governor Kay Ivey at a news conference where she's updating us on the COVID-19 mask order. We'll check in right now with Governor Ivey.
Before we get into the update on our current health order, I wanted to speak briefly about what happened last week or earlier this week. On Tuesday, in the days leading up to November 3, Americans turned out in record numbers to cast their votes. This expression of freedom and personal responsibility is a hallmark that distinguishes the United States from many other countries around the world. As everyone knows, this has been one heck of a year, and one that most Americans want to get behind us. But just as important as we had an election so that the people could make their voices heard, it's also equally important, perhaps maybe even more so, that we look for opportunities going forward to bring our nation back together. And friends, that means searching for common ground, cooperating when and where you can, and meeting people in the middle. This does not mean you have to compromise your values or your morals, but the bottom line is we've got too many big things to do during the coming weeks and days to get sidetracked. So the sooner we can start coming back together, the quicker our country will get back on the path that we were headed before COVID-19. As you all know, Dr. Harris and I come to this room every month or so to provide an update on our current health order and to talk about what our plans are going forward. Our current order expires this Sunday, November 8, and I must admit, when we issued that first state of emergency back in March, most of us had hoped that we would not even be having to worry about COVID in November. Yet here we are 8 months later, and our state, our nation, and our world are still grappling with how to keep people safe, while at the same time ensuring that those who have jobs can keep on working, and those businesses that have been sidelined can get back to work sooner rather than later. We certainly know that this disease has disrupted our lives and our livelihoods in significant ways. More than 3,000 Alabamians have died from this deadly virus. While obviously some folks are more susceptible to COVID-19 than others are due to age and pre-existing conditions, no one is immune, as we are all capable of contracting this virus. So even as we continue to emphasize good, sound health practices, such as wearing a mask or social distancing, we must at the same time be able to find a proper balance on living our lives to the greatest extent we can. We are extending our statewide mask order through Friday, December 11. But there are some notable areas where we are relaxing some of our current restrictions. As you know, from the outset, I said from the beginning of this pandemic that you cannot have a life without a livelihood. And so in order to alleviate the burdens placed on our retailers, small businesses, and restaurant owners, we'll be rolling back restrictions placed on the occupancy rate. Simply put, this should be welcome news as we get ready for the upcoming holiday season, which is often the bread and butter for retail, and especially for our locally owned small businesses. Moving forward, these businesses can resume their, quote, normal operations in terms of the number of patrons that are allowed inside their establishment, as long as they are wearing a mask and complying with other sanitation guidelines. Also, our close contact service providers like hair salons, nail salons, and spas will be permitted to increase capacity by maintaining sanitation and social distance guidelines. Specifically for restaurants, if they install plexiglass partitions or some other divider, then they will be able to increase the number of patrons that they are serving daily. The key to all this is if you mask up and social distance, you can increase occupancy. Increase occupancy in your businesses. When Dr. Harris and I spoke last to the people back on September 30th, I tried to be clear then that my hopes and plan were we'd be in a position to let our mask order expire by this time, reverting from a mandate to a strong recommendation of personal responsibility. I know you can't go on forever with a government mandate, especially if you don't have buy-in from the public we all serve. However, I'm willing to keep the mask order in place while acknowledging that sooner rather than later, it's going to be up to each of us to do the right thing, regardless of whether the government is mandating it or not. And folks, we're now entering the cold and flu season, and you add the COVID-19 to that mix, it could present a deadly combination that only adds to challenges of an already challenging year. As Dr. Harris makes his way up to the microphone, I'd like to once again thank the people of Alabama. We are listening to you, and we're trying to best understand your concerns and make the best decisions humanly possible. Personally, I've never wanted to convey that through these health orders that either Dr. Harris or I have all the answers. I can tell you we sure do not. But I know I speak for Dr. Harris when I say we are truly grateful to the people of Alabama for their support and their understanding. Dr. Harris.
Thank you very much, Governor. And I do want to say thank you so much for all you're doing to protect the folks in our state. We sincerely appreciate it. And I certainly want to reiterate to the people in Alabama, thank you for what you're doing to protect the folks in our state as well. We're really grateful for all the support that we've had for so many things. I want to give you just quickly an update on where our state stands. We are right at 200,000 cases in Alabama so far since this response began. We always like to remind you that that represents unique individuals, 200,000 separate unique people who are tested multiple times only get counted once. So that's around 4% of our state's population that's tested positive so far. We're up around 22,000 new cases reported to us in the past 14 days. Some of that is increased by the data dumps that we've talked to you about. We try to post that information prominently when we receive those, but nevertheless, we are seeing increase in numbers of cases somewhat. We had a plateau really from mid-August through the end of October, or the middle of October, and we've begun to increase somewhat over the past 2 to 3 weeks. Our percent positive rate is up to around almost 10%, 9.8%. And I think you're all aware that our hospitalizations have been, on most days for the past week or two, around 1,000 or sometimes over 1,000 people. There are about 18 states in the country this week that reached highs for hospitalizations. Alabama has not done that yet. As you know, we're significantly higher back in the summer, but still over 1,000. And as the governor mentioned, we're very sorry to report we've lost 3,000 of our friends and family and loved ones to this disease. We certainly acknowledge the difficulty of trying to balance all the different factors, the public health factors and economic factors, and tremendously supportive of what Governor Ivey's doing. She's done a terrific job with that. I wanted to mention just some specifics about this order. We've gotten a number of questions about a few things that I thought I would just specifically address. We had many great conversations with Coach Savarese at AHSAA, and he had, in particular, had asked about whether this would affect the high school football playoffs or other athletic events. And in fact, You see some capacity restrictions related to commercial athletic facilities, but that has not changed anything that's in place now regarding spectator sports or high school sports. So those same distancing and mask requirements that are in place now remain unchanged for those sporting events. We certainly understand that many states everywhere are using physical barriers. It certainly makes sense as a way to increase capacity in restaurants. We understand how important that is to those businesses. And so with restaurants and with close contact providers, barriers will allow them to accommodate more people. It's important for us to emphasize that the guidance we have from CDC about close contacts remains the same, what we sometimes call the 6-15 rule, people within 6 feet for 15 minutes or more to a case, exposed to a case, are people who are considered close contacts, and that's not changed by barriers and not changed by masks. We hope to be able to relax that at some point when there's enough evidence to do that. So even though these barriers are certainly allowed and capacity can be increased, thankfully, the definition of a close contact is still the same that we have from CDC. Finally, I wanted to say just a couple of things about the vaccine, the COVID vaccine. Work continues steadily on the vaccine project. We had a terrific call yesterday with General Gustav Perna of Operation Warp Speed. He called Alabama individually himself just to talk about vaccine issues as he has been reaching out to all other states. He didn't give us a lot of new information, but really confirmed what we have been hearing all along. He believes that there's likely to be 1 or 2 vaccine products made available by the end of this year. They expect that the Pfizer and Moderna vaccine products are going to submit to FDA for emergency use authorization in the next few days or in the next week or 2. That obviously has to be reviewed by FDA, but as soon as that EUA is given, the plan is to ship vaccine directly to Alabama right at that point. Now, there'll still be some additional steps before the vaccine's actually authorized and being able to be used. And I'll be happy to go into those details with you, but we will have vaccine pre-positioned in Alabama sitting here waiting, and if, when and only if, it's confirmed to be effective and safe, then it'll be ready to go really just at a moment's notice. So again, I think our concern still has to do with uptake. How many people are going to be interested and willing to take the vaccine. We're working very hard to get the message out and communicate in a real transparent way what we think about the vaccine. I plan to take it someday when I'm eligible. Hopefully I won't be eligible for a while. But I certainly think that when we finally get a product available, it will be safe and it will be effective, and we hope to help Alabamians understand that as well. So that's all the remarks I have, Governor. Be happy to answer questions. Thank you.
Thank you, Dr. Harris.
All right, we've been listening to Governor Kay Ivey along with the State Health Officer, Dr. Scott Harris, extending now the Safer at Home order to December the 11th. Of course, due to the numbers, Alabama has now gone over 3,000 folks in our state who have died due to coronavirus. Also now more than 200,000 cases, and concerned about in just the last few days more than 22,000 cases. So the Safer at Home order has been extended now to December the 11th. The governor encouraging all of us to do our part in the communities that we live in to deal with this, asking us to compromise, come together, and search for common ground to wear our mask and social distance. They also talked about relieving some of the occupancy rates for certain businesses to help them through the holidays, which is when they usually make a lot of money for the small businesses, the hair salons, beauty shops, nails, as well as restaurants, and telling restaurants they have to use plexiglass, along, of course, with enforcing the mask and the social distancing in their establishments. But that will help them hopefully make it through this period, as we are still concerned about the virus spiking in many places, even in Alabama, and of course Mobile reporting more than 100 cases just yesterday as well. They are very concerned right now about the spiking, along with the flu season coming now. They say it makes a deadly combination, so encouraging us to do the right thing in the public as we go about with the mask and social distancing, and also reminding us that the work continues on a vaccine and no new information yet, but still thinking that a vaccine may be available by the end of the year. Of course, we'll have a listing of all of these for you with the new amended Safer at Home extension to December 11th for you on our website at fox10tv.com. And of course, we'll have more information for you on air, on our social media platforms, and of course, the news beginning at 4 this afternoon with Lenise Lagon. I'm Eric Reynolds. We'll be right back with you soon.